Wondering what a dental assistant does on a daily basis? We've broken down a day in the life of a dental assistant to help you understand what it takes to be a dental assistant. The morning meeting. As a dental assistant, your day may start with a morning meeting. This is an opportunity for the dental staff, including the dentist, office manager, assistants, hygienists, and front office staff, to discuss the daily schedule and treatment plans. This is your opportunity to get organized and work together as a team to plan out the day. Patient prep. After the morning meeting, many dental assistants will begin preparing for each of the day's patients. At this point, the dental assistant will look at each patient's chart and prepare a tray based on that individual's treatment plan. In some offices, everyone may pitch in with this effort. You'll turn on equipment and prepare the sterilization room. This may include filling the ultrasonic, removing instruments from the autoclave, filling water bottles, and flushing water lines. Treatment room prep. A dental assistant will get the treatment room ready for the first patient, set up trays, cover the seat and headrest with a barrier, and may use barrier tape on equipment that will be touched by the dentist or hygienist. Interacting with patients. The assistant will greet the patient once they've checked in at the front desk and filled out all their forms. Then the assistant will guide the patient back to the treatment room, seat them in the room, and help them put on a bib. Charting. Next, the dental assistant will ask the patient about their health history, particularly if there are any changes since their last visit, and record all information and procedures in the patient's chart. Assisting the dentist. The duties here will vary depending on the procedure and may include anticipating the dentist's needs, handling the appropriate dental instruments, handing them to the dentist at the appropriate time, taking instruments from the dentist once they've been used, suctioning. Initially, this may be the hardest part of the job, as a new assistant may have difficulty anticipating the needs of the dentist. However, as your rapport with the dentist improves over time, you'll be able to anticipate which instruments the dentist prefers and the order they like to use the instruments. This process becomes a very natural and easeful flow. Four-handed versus six-handed dentistry. In some cases, it may be just you and the dentist working together on a patient. When this is the situation, this is called four-handed dentistry. However, depending on the procedure and the dentist's preferences, you may also engage in six-handed dentistry, where there are two assistants working together to provide support to the dentist. These situations require even more collaboration and communication, which also improves the longer you've worked together as a team. Dental assistants may take x-rays pre or post-op. This requires training in order to understand how to use the equipment. Now that the first patient is done with their treatment, you'll walk them up to the front of the office and say goodbye. Then you'll start over with preparing the room for the next treatment. You'll remove the patient's tray, taking it to the sterilization room and putting the instruments in the ultrasonic, then the autoclave. You'll clean and sterilize the room and get the new patient's tray. Then you'll greet the next patient and do the entire process all over again. Working in multiple rooms. There are many ways to cut down on treatment time, and many of those include teamwork and the use of multiple rooms. For example, sometimes the front desk staff may assist the assistant in cleaning up and prepping a room to cut down on the time between patients. If the dentist's office has multiple rooms, sometimes the dentist will be finishing up with one patient while the dental assistant will get the next patient started on their treatment. This may include walking them back to a second treatment room, getting them comfortable, taking their medical history, and charting new information, and taking any pre-op x-rays. While this results in improved time management for the office as a whole, it may also result in a lot of hustling for the dental assistant with very little downtime between patients. The end of the day. After the last patient of the day has been seen, the assistant helps to clean everything. This includes all the treatment rooms, emptying the water lines, cleaning the suctions, and sterilizing any equipment that has been used. After everything is clean, an assistant may prepare the tray for the next day's first patient, so the next morning runs smoothly. Other duties. Other duties of a dental assistant may include making phone calls to patients, long-term instrument and sterilization maintenance, and other duties assigned by the dentist. We hope that this video helps you understand more about what it's like to work as a dental assistant. If you found this video to be helpful, please like and subscribe to see more videos like this. Princess Dental Staffing is an online dental job site offering full-time, part-time, permanent, and temporary jobs for dental assistants, hygienists, front desk, and even dentists in a variety of areas. Visit our website to view dental jobs in your area or create a profile to put yourself in front of employers.